Dr. Bregman. We have a letter from Tiffany that is coming in from Santa Monica, California. And I've noticed that a few of these letters, unfortunately, are having this theme. I suppose it's the sign of the time. And it's about potential suicide. This woman is having suicidal thoughts. And what she writes is, "Hi, Dr. Bregman. I need your advice. Being at home alone during this time of coronavirus has left me bored and depressed, so I find that I'm drinking every night. I actually drink a lot. The more I drink, the more depressed I get. I'm really down right now, and I'm starting to have suicidal thoughts. I'm afraid to tell anyone. What should I do? Please help."
Well, this is quite a problem, and a problem that it can be the sign of the times. I mean, the interaction between the virus and being alone at this point has certainly caused a great amount of distress for you. And I think you're coping using the alcohol. And alcohol is a depressant, and you're starting to get depressed. Having suicidal thoughts is different than having a plan. Now, if you have a plan, then we have to push the emergency button, and you need to get immediate help. You got to call 911 if you think you're going to do something, or you're going to go to your nearest emergency room. If you don't have a plan, I don't hear that you do at this point, then let's talk about how we could get this drinking under control so it doesn't run you. Now, so I really think that you need to reach out. AA is still around. You could Google them. There's support groups around. That would be good to do. You may need to really be assessed to see if you have some comorbid depression, which you mentioned. So you can get online. There's a lot of telemedicine, telepsychiatry available in your area now. And you would want to be assessed by a psychiatrist to see if you have some underlying mood disorder like depression. You could possibly need some medication management. So I think these are a few ways you could start.
Well, let me ask you something. Should she contact a telemedicine doctor first and AA second? What's the procedure?
Well, it depends on the individual. Some people don't feel comfortable contacting psychiatry, then maybe just reaching out to the support group may work out just to start. But if this is really a dire kind of situation, then I'd reach out to the psychiatrist right now, get an emergency online appointment, let them know that you're having suicidal thoughts, and I'd start out that way. And then the doctor will probably also try to implement a treatment plan which would encompass some outpatient groups and reaching out with support systems.
As I go through these emails, I'm seeing such a depressed theme. What are you seeing in your practice? Are you seeing people with suicidal thoughts during this time?
Well, unfortunately, yes. I mean, I am seeing a tremendous amount of people having things like, well, life's not worth living, this is the way it's going to be, they say it's going to go on a long time, and people are getting to reach the end of their rope. They've had the cabin fever, being isolated for a period of time. That certainly makes people's fears, concerns, and the consumption of, unfortunately, medicating people themselves with alcohol, drugs, has become a huge problem. Also, people who have underlying mood problems, we call them affective disorders, bipolar disorder, depression, etc., they really can have some seasonal variation. And we're moving into the end of spring, the beginning of summer, where is the height of the seasonal affective disorders. So this is a great concern, for us as professionals now, and we would have to see if some of the individuals that are writing letters to us also may be suffering from some seasonal affective disorder, which could unfortunately lead to some dire consequences like suicide.
So we should wrap this up and remind people that if they are at that point where they are having suicidal thoughts right now, to dial 911, correct?
Yeah, especially if they're having suicidal thoughts with a plan, then they should dial 911 or just call their nearest emergency room. Get the help right now. I mean, the way you feel at this moment, after you get some help in another few days, you're not going to feel the same way. And we don't want you to do anything that you can't reverse.
Absolutely. Well, thank you for your advice, and we'll talk soon.
BregmanMD Medical Group offers online psychiatry and online therapy.